everyone. I know it's definitely a little late right now, about 12:41 Eastern Standard Time. So I am in LA, and because I'm in LA, it's a little bit lighter right now. So it's around 9:40, so it doesn't feel as late. But I know for my Eastern Standard people, it is late. But it's also Friday, so that could be making it easier. Maybe people are still up on Friday, which I assume they are. That's when everyone's doom scrolling a lot later too. So yeah, welcome Dr. Chrissy. Good to see you. Welcome Hellmoon. Afternoon. Afternoon. What time is it for you? Right now it's, well, at least in the West Coast, is 9:42 doing notes. No, see, this is the problem with the American healthcare system. If you are doing notes on a Friday night, then that's why there's a big problem here. This is why doctors are burning out. This is why they're moving to private practice, because the system is literally keeping all of us down. See, that is the issue. And I don't even say it from a wellness perspective. I say it from okay, this is why a lot of psychiatrists, especially, are going to private practice, is because they want that autonomy. They don't want to be just doing notes and just being a cog in the machine, just a part of the system, just pumping out patients, and that's what they're doing. And I think it's time for docs to fight back. That's the only way. It's literally the only way. Otherwise, I think doctors' salaries are going down. I think that the respect is going down. Everything is not in the med school loans are going up. All of that. So all that to say, sorry that you are doing notes at this time. So Sandra says, I have a new doctor this week. Okay, hopefully they're good. Quentin, hi, welcome. Good to see you. Good to see you. I have been let down by mental health services and clinical people. Yeah, I often describe mental health services as, especially seeking therapy, it's almost like in dating in a way where you have to make a really good connection with someone for it to be valuable, and you don't know where stuff is going to go. So you often have to shop around till you find someone who is very helpful. Psychiatry PGY1 here. Awesome, awesome. So I'm actually at the APA right now, American Psychiatric Association conference. So yeah, if you are here, definitely say hi for sure. So yes, Quentin asks, how do I stop vaping? So that's a good question. I'll tell you what's worked for me. So I remember at my worst was when I had 3 different vapes. I had a vape in my drawer, I had a vape in my car, and then I had a vape at work. And I remember just coming home one day, well, because I was experiencing shortness of breath. And I remember coming home one day and I was like, this is so dumb. Why am I doing this? Like, there's no benefit I'm getting anymore. And so I remember I literally just threw them all out in the trash at one night. And so I would like to say that, like, that was it and I stopped. But no, it was not it. Because what happened after that was I remember going into my trash the next morning and then picking it up and using it again. And so I know how it definitely is, how it hits, right? So what I've found, at least, the best thing has been for me is to not purchase it. That's the best thing, is because, and I do the same thing with desserts too, where I have a big sweet tooth, and so after every meal I would always have desserts, like at home, like ice cream or cookies or something, until I realized that, okay, this is not getting me my long-term goals, and these are literally unnecessary calories. So what I did was I got rid of all the desserts, or like once I'd finished them, I didn't buy any new ones. And instead, I swear the only sweet thing that I have at my home are protein bars. So I'm like, okay, well, if I have to have a dessert, something sweet, like, all I can go with a protein bar. And a protein bar is 200 calories, 20 grams of protein. So, like, that's an okay thing that I'm doing. So to answer your question, the best thing that you can do is to get rid of it. And honestly, just getting rid of it has made such a huge difference to me. Like, I don't even think, if it's not around, I don't even think about it. But if it's around, then it's like, you're gonna hit it. Quest. Exactly. Yeah, Quest 14 bars are my favorite by far. What you want to do is you want to microwave them. That's the secret trick that no one tells you. And I remember how I discovered this was I I had the Quest bar in my bag, and I had left it out in the sun, and I'd come back, and I go to get a protein bar, but it's all like mushy and soft because out in the sun. But I start eating it. It was like a cookie. It was a chocolate chip cookie dough one. I still remember it. And so I eat it, and I was like, this tastes really good. What the hell? And so I start looking it up, and everyone's like, yeah, you should microwave these. And then ever since then, I've went back into microwaving Quest bars, and never looked back. Is there any big difference between a psychiatrist and LP? What is an LP? I'm not sure what LP is. You look like a movie star, man. Nah, this is just Los Angeles. I'm in LA, so I think you're just you're just getting those vibes right now. I'm gonna try it. Mint one for me. No, so the best high protein recipe that I've ever come across is you get Greek yogurt, get like maybe a good scoopful or two of Greek yogurt. It's about 200 calories, and that's easily like 25 grams of protein. Then you mix it in with protein powder, and then you warm up a Quest bar. You warm it up for like 20-30 seconds, and you cut it up into little tiny squares, and then you mix it in with the Quest bar, with the Greek yogurt, and now that concoction is about 500 calories, at least like 60-70 grams of protein, and satisfies all my dessert cravings. So that is like a huge win-win, and yeah, ever since I did that for desserts, like I don't even look back. Kate asked, what is the difference between a Psych PA and a PMHNP? Yes, a good question. A Psych PA goes through the medical route, where they go through PA school, which is a very medical, traditionally based curriculum. So they go in with the intention to become a provider, so they learn a lot of the same curriculum as doctors do, just not to the same level of depth and extent. Whereas NPs, they go through the nursing route, so they're trained as nurses first, and then they go to their Psych NP program. So that's different than the nursing route, or than the PA route. So they come at it from different perspectives, different like backgrounds at it. But in the healthcare field, they tend to have very similar roles and tend to command similar salaries. Do you train NPs? Yeah, so I run an NP coaching program, and basically what happened was I started going live, and I started to have a lot of NPs reach out, and they were like, hey, can you collaborate me? Can you precept me? I felt like my learning was not good. Just asking me questions like about mental health stuff and psychiatric medications and diagnosing, because they're like, no one's taught me. My preceptor doesn't do anything. My patients don't really respect my judgment. The MD supervising me doesn't respect me, or basically they take my money, but they don't actually like supervise me or give me guidance. And my first job has 20 to 30 patients, so I'm just stuck here all by myself, seeing all this stuff. And so I started seeing these comments over and over again. And so I was like, okay, no, we have to do something about this. And so I started my program, because since I'm a psychiatrist, I've gone through med school and residency. I was like, okay, well, I need to spread this knowledge, because knowledge is useless just sitting here. And so I started the program, and we had 10 people sign up in the first 2 days. And so I was like, okay, like there is something here. And then I started doing it more and more. And then that's when I realized that what my students told me was all these problems, where Psych NP school was not good, it was not rigorous. Like a lot of people would graduate, they just felt unprepared. I think the school system is taking advantage of you, and quite frankly, just pumping out numbers. And so all of this stuff happened. And so I was like, okay, like this is a problem. And so now, right, what I want to do is, like, I think we need to change the NP education system, because right now they're not training you and they're leaving you out to hang to dry. So that's my goal with this. This is more than just like a program. This is a mission, and the mission is to literally change the NP psych curriculum, because that way you can get respect, and you can get the clinical competence and confidence that you need to prescribe independently, to be able to take care of your patients, and to be able to earn respect from colleagues and things too. So if that mission interests you, if you want to be a part of that, and if you're an NP and you want to get training and coaching for me to really level up your psychiatry skills, then definitely look at joining our program. And here I will post a message here, so you can just send me a message here. That's the best way to do it. Mr. Binney says, In ADHD patients, have you had more positive effects of guanfacine versus clonidine for ADHD symptoms? Yeah, guanfacine is better for daytime. Clonidine's a little bit better for nighttime, but also better for severe stuff. Clonidine's a little more sedating. That's the main change. So if I have an ADHD patient, I'll go with clonidine to help them go to sleep. I can't do anything boring like chores or tasks and can only do things that I got dopamine from. Yeah. Well, see, that's because our dopamine systems are fucked today. And the reason that they're so messed up is because of technology. And there's a thing called dopamine detox, which I've been on for the last like 2 or so months, where basically all these high dopamine stuff, phones, TV, games, scrolling, all of that, it spikes up our dopamine to here. So now regular activities are only up to here. So dopamine gets way spiked up here, regular activities are here. So we only gravitate toward this high dopamine activity. So what you have to do is you have to detox. So you have to get away from all those high dopamine activities so that way the normal day-to-day stuff is a lot more enjoyable. So for example, the last couple months I've been at my parents' house because I really wanted to focus on this coaching program and build it to be the best psychiatric education program that there is. Basically, my goal is to download all my knowledge from residency and fellowship into this program so that way you can access it. But so I did that because I wanted to get rid of all the dopamine sources of living in New York. So that's why I went to my parents' house where there's none of that distraction. And so now doing those kind of chores, daily grinding business tasks, are super fun. And because they're super fun, it's a lot more enjoyable. So yeah. Are you going to the APA conference? I am. Yes, I'm literally here right now. I'm in my hotel room. It's 9:53 p.m. on this this Friday night. So yeah, I'll be there for the entire 5 days. So yeah, come say hi if you're around. My boyfriend's there. LOL. That's funny. Yeah, tell him to look out. I'm giving a talk as well. So I'm giving a talk on social media and how things that stop physicians from getting into social media. So that's on Wednesday at 3:30 p.m. Wednesday at 3:30. Please view my comment. I'm not sure what your comment is, bro. But the best way to see your comment is to get your comment noticed is to subscribe, because when you subscribe, then your answers stand out above everyone else. So yeah. So for example, Lex, yeah, thank you for the sub. See, so when Lex speaks, then it literally tells me that. And then Apple user 4296259. What would you prescribe for dopamine dysregulation if detox doesn't really work? Detox does work. You just need to stick with it. It's hard to do. It's an addiction, right? So you have to withdraw from that addiction. But if you want pharmaceutical options, naltrexone is what we typically use to deal with addictions. So it decreases the pleasure that you experience from things. So naltrexone is a good option. High protein diets, they release more tyrosine and dopamine into your system naturally, so that can help focus. L-tyrosine is a supplement that can be used. Creatine you can also use as well. It's a stimulating supplement, so that can help with ADHD and dopamine stimulation in general too. I know there's no FDA approved med for BPD. From your experience, any med that worked well? Yeah, Lamictal's good, especially for a lot of the depression. I like Abilify a lot too for some of the agitation and the self-destruction. And I like Seroquel. Seroquel is my favorite personally because I think it's very calming and it helps with sleep. My voice has disappeared overnight after 14 years of having them. Antipsychotics. Nice, congrats. Can you talk about salvia? I'm not sure what that is. Saffron has helped me a lot. Yeah, saffron is it's good for mild to moderate anxiety and depression. There's some studies that can help with that. Does ashwagandha help anxiety? It does, yeah. Ashwagandha is helpful for anxiety. Basically, it's what we call an adaptogen. What that means is that it reduces your body's response to cortisol, basically helps decrease the cortisol response. So it doesn't help anxiety immediately, like say a benzo like Xanax would, but it helps decrease anxiety over time. So it's better for a long-term solution. Can you live your life as a bipolar with no meds and thrive? Depends on how severe it is. Bipolar 1, probably not. You're risking mania. Bipolar 2, yeah. I have a patient who we got her on a keto diet, and she said that literally she stopped experiencing all of her depressive symptoms when she did it consistently for a month. So it definitely works. Yeah, the keto diet has a lot of evidence. It has evidence for epileptic disorders because it tends to stabilize the temporal lobe. And so that's why the evidence has been shown over for bipolar disorder as well. Everything is laggy, delayed, and glitchy when you're on it. Yeah, this is the hotel Wi-Fi that we're on. So I think we can only do so much. Opinion for low dose Seroquel for anxiety. It's not the best for anxiety. It's more best for like sleep, and like it can be. It's calming. Hydroxyzine is usually what we use more go-to than Seroquel. Not you. I'm seeing people on salvia. Why are you at a hotel right now? Wouldn't you like to know? Why aren't you not out and about? Because it's a Friday night, and work is what I live for, and that's why I would rather work than do degenerative things like that. And I'd rather spend this time right here, right now. How would you feel about 20 milligrams of IR added all for ADHD? How would you feel about 20 milligrams of immediate release added all for ADHD? I mean, that's a pretty standard dose. That's fine. Nothing to be concerned about. Yeah. What your job is your dopamine. Yes, exactly. See, that's the key here, is that when you detox from all the destruction around here, then I remember hearing this advice from an entrepreneur, basically said, you want to make your day so that you want to make it so that your work and your like your business, like you want to structure your day so that becomes the most fun thing of your day. And like that's how I literally feel. Like I would rather work on my business than do anything, because like I've cut out most of the like like TV and games and all that. Like I only do that stuff maybe at nighttime, but during the day I don't do any of that because I want my work to be the most fun thing I have all day. And the more distractions and stuff that you give yourself, the harder it is to do that. Olanzapine long term, is that a concern? It can be, yeah. Olanzapine long term is a concern for sure. Yeah. It can cause weight gain. Weight gain, cholesterol, that's the biggest thing with it. Do a 360 of the room right now. I would rather not do that. What is your thoughts on Rexulti with venlafaxine? That's fine. That's totally fine. 120 milligrams of duloxetine, high or average? That's definitely on the high end for sure. I can spend hours doing images, but have a hard time doing tasks. Yeah, everyone's like that. Like, there's things that you give you joy and excitement, and then there's things that do not. So, the thing is that you want to structure your day so you do the tasks that give you the most enjoyment, but they're also productive too. So this is a big business concept as well, where basically you want to try to offload some of the tasks that don't really help you, but then the tasks that do help you, you want to keep those. What can help akinetic mutism? I'm not really sure. Switching from Wellbutrin to Guanfacine, need to taper to cold turkey? No, you definitely taper. Most psych meds you want to taper. You don't want to go off cold turkey. Why are you in hotel? Yeah. So I'm in LA. I'm in Los Angeles for a conference right now for the American Psychiatric Association conference. And so it happens every year. So this year it's in LA. So yeah, so if you're coming, drop by. Is Vyvanse long-term okay? I mean, ideally not, but it helps a lot of people. So I would just say make sure that you take tolerance breaks. Vyvanse helped my depression so much. My depression and irritability had to do with undiagnosed ADHD. Yeah, that's a common thing. That's a very common thing. Oftentimes, undiagnosed ADHD can lead to other issues for sure. combo idea for anxiety while taking escitalopram. You could try the supplement L-theanine. That one's really helpful. Looking for a geropsychiatrist to join our practice if you know anyone at APA. 35 minutes from Chicago. Looking for a geropsych, 35 minutes from Chicago. Okay, just send me a message to remind me, and I'll keep a lookout. Can you go on Wellbutrin long term? Yeah, I have some patients who've taken it for a while because it really helps them with their depression and ADHD. Vyvanse is amazing. Yeah, it's really good for binge eating, and it's good for long-term ADHD control, like control ADHD control throughout the day. Is sertraline bad if you're trying to conceive? Actually, that's the safest one. I have a patient right now. She's on 75 milligrams of sertraline, and it's done wonders for her anxiety. And you do want to make sure that you treat that stuff like anxiety and depression in pregnancy, because if you don't, then the mom gets more stress, which leads to high cortisol, the stress hormone, and cortisol chronically is damaging. Also, is guanfacine better for hyperactive body or hyperactive mind ADHD? It's more for mind. I mean, it's both actually. It's body and mind, but it's better for hyperactivity in general. What would you prescribe for diversion disorder? I'm not sure what diversion disorder is. Conversion disorder I know, but I don't know diversion disorder. Conversion disorder is more about finding the underlying cause of whatever the thing is going on. That's the most important thing. How to stimulate... Oh, rip. Hold on. I already lost the question. Okay, Mel says, what do you think about a 27 high functioning autistic female starting guanfacine? Yeah, that's totally fine. Yeah, guanfacine isn't just used for kids as well. It's also used for adults too. It's not just not used for kids. Mel says joining your PMHP group, by the way. Nice. Yes, we will see you inside. Yeah, we've had over 120 members join in the past 2 months, so it's really blowing up, and people are finding a lot of value out of it too. Because I really think the system is fucked. Like, they're not teaching you. For example, one of my students literally told me that I'm jealous that you got to have a residency, and it's something that I took for granted. Was, yeah, man, we got to go through residency. But he said that, and he was like, yeah, because I just graduated from NP school, and I feel like I know a fraction of what I should know, and I'm in my job right now. They're just throwing patients at me, and I don't know what's going on. And I was like, this is kind of a problem, because they're just expecting you to see these patients and not teaching you. They're just taking your money, $20,000 to $60,000, just cash grabbing you, just pumping you out of the system. And it's not right, because I know that you just want to treat patients. I did an interview with 2 Psych NPs like a couple days ago, so I'll be putting out clips for that. And something they told me was that the curriculum is not standardized. So some people could learn really good stuff, whereas other people could not learn anything. And some of my students also told me that people in their clinical interviews ask them about ask them clinical questions like, what's the mechanism of action for this? If you got a clinical case conference, or if you got this clinical case, what would you do? Like, asking them all these detailed technical questions. And I was like, every interview I've been on, it's just been hanging out, shooting the shit. Because as a psychiatrist, they trust my expertise. Because they know that I've been through a residency and a fellowship, there's already a baseline level of clinical competence that's assumed. So no one has ever asked me a clinical question in an interview. But the reason they're asking you is because they don't trust your judgment, because the training is so messed up. Like, I'm not saying some people get really good education and they really seek it out on their own, but others do not. And so and I think those bad apples make you look bad if you're an NP who actually cares about doing well and doing right with your patients. And I think it's taking away respect that physicians and the public have, that they give you too, and we want to make sure that you get that respect back. So that's why this is more than just a program. It's a mission. Like, we have to change this NP education system, and no one else is going to change this, right? For patients, for yourself to be a good clinician, to have other doctors respect you, right, and treat you as good members of the clinical team and trust your judgment. Like, we have to actually change this, and this is how we change it. Only entrepreneurs and business people, like, they're the ones who change the world, and this is the movement that we're going to change it with. And something I tell my students is that, people are going to judge you no matter what you do, but what you need to do is just make sure you are so clinically excellent that no one can doubt your skill. But yeah, so best place for you to join, it's in my bio, or you can just send me a message. As a 24-year-old, and I can send you the link. As a 24-year-old, I was just diagnosed with ADHD. Is it normal to be on Strattera first? Yeah, it's fine. I mean, it's not abnormal. It's fine. Some people want to start with non-stimulants. Some people want to start with stimulants. So, yeah, it's fine. Why are the APA conferences needed? Yeah, so these are for us. Like, this is for psychiatrists to network with each other and to share clinical knowledge and expertise. So, for example, I'm giving a talk on social media and how to get on social media, how to grow a following on social media. So I'm literally giving a talk on this on Wednesday because I think it's something that doctors need to know. There's a lot of misinformation out there, and most mental health conversation topics are not by psychiatrists and doctors. They're just by, like, average people, and a lot of people are giving the wrong advice. So I think doctors need to know how to get on social media. So that's why I'm going and sharing my expertise on that. But, like, it's all about clinical. Like, there's a ton of clinical topics, like new discoveries in medications and therapies and residency programs, and there's going to be a lot of networking too. Like, people from all over the world come to this conference. So it's like the one time a year where, like, psychiatrists all get together and hang out and network. So yeah, that's what it's for. Why I always have negative thoughts, making me feel like I'm not enough. Yeah, so good question, right? So remember, our brains are primed to be negative. It's called a negativity bias. What this means is that back in the caveman days, you wanted to be more negative, so that way, if, let's say, something in the trees rustles, you think, oh yeah, saber-toothed tiger, or predator, and then you get on guard. Versus if you have no anxiety or no negative thoughts, then you don't really perceive that. But now the game has shifted to where there's so many distractions and things, and our lives aren't in that kind of danger anymore, but we still retain that negative mindset. So you have to train it to the opposite. You have to do what's called positivity bias training, where you start training your mind to think more positively instead of negatively. Should a family doctor prescribe mental health meds? Yeah, I mean, that's literally their role, right? Like, they are the catch-all. They are the generalist. And so they catch all the people who see them. And, like, that's what their responsibility is, general. But then when things get more complex, they refer out. So, for example, I don't just... the cases I see are not just like, oh, yeah, this person's depressed. You give them Lexapro and then they're fine. No, you see the patients who've tried, like, 3 or 4 things and it doesn't work. Then they're like, okay, what now? That's the kind of referrals that psychiatrists get. Hi, Doc. Hi, Carlstein. How are you? A regular doctor put me on 400 milligrams of Effector. That is definitely high dose. But so actually, if it's the immediate release, then 375 is fine. But in the normal release, for the XR release, you usually go up to 225 or 300. Most psychiatrists told me a family doctor isn't meant to prescribe mental health meds. I mean, it's not that they're meant to, it's just they see the most of it. The psychiatrists see the complex cases. Otherwise, the psychiatrists would be overwhelmed with the basic cases too. Do you accept consults from Canadians? Yeah, so I've seen a couple, some Canadian clients before. Typically, we'll work together with their GPs. So, so I might do a consult and then, like, give my thoughts, and then the patient will go to their general practitioner, and then they'll prescribe the medication. Yeah, but no, if you have any kind of complex mental health condition, you definitely want to get assessment from a psychiatrist, because the problem, if you get assessed from a GP or a primary care doc, is that you'll try something and you might not know if it's working, and then you might switch, or you might try something else again, but now you've literally wasted months of your life still suffering, trying the wrong stuff, when you could have just gone assessed by a psychiatrist and gotten the right diagnosis and treatment. So if you definitely think yours is more severe, right, you definitely want to get assessed by a psychiatrist. And so if you want to get my help or my assessment, best way to do that, just book a consult in my bio, or just send me a message, and then I can send you the link. But that's the best way to have me assess your situation. Brittany, thank you for the sub. So she says, I have been on Effexor for a month and noticed a slight change. Should I ask about upping my dosage? So it's good that you've noticed a slight change. That's beneficial. That's what a month is a good time to assess that too. So yeah, I think, especially if you're on a starting dose, you may want to go a little bit higher, but it depends. Sometimes you just want to wait it out too. But a month is a good time. Does Effexor usually make your eyes dilate? It can. Yes, it can. So it's a fight or flight. So basically, Effexor stimulates a neurotransmitter called norepinephrine, and norepinephrine is our fight or flight stimulator or neurotransmitter. And so think about it like if you're in a fight or flight state, your pupils will dilate because you want to be able to take in more light and you want to be able to perceive things better. Awesome, Ashlyn. Thank you for sharing the live. Do you have a cold? I do have a cold, yeah. Hi, Agame. Did you have a good time at the U of Alabama? Did it challenge you academically? Yeah, I mean, I loved Alabama. It was a great time. It wasn't the most academically rigorous, but I was okay with that because my med school more than made up for it. College for me was just basically getting the grades I needed and leveling up socially and having a blast. Like that was my goal with college. So to do what I needed to do to get into med school while having as much fun as possible. So, yeah. But then med school, of course, it's like, that's hard. What is your favorite lecture? APA starts tomorrow. Today was just the travel day. It's going to start tomorrow, so I'm excited to see where it goes. No, well, you're 32. I'm 31, actually. But yeah, I'll be 32 in a couple months. Did you go to same med school in Alabama? So I went to University of Alabama at Birmingham for undergrad, and then went to the University of South Alabama in med school. Wait, shut up in Chicago. No, actually, no. So the APA conference is in LA right now in May, but actually, I will be in Chicago. I forgot about this. Yeah, so I'll be in Chicago in October for the American Academy of Child and Adolescent Psychiatry conference. So I think I'm going to be there. I've submitted to be a speaker, and if it gets accepted, I'm just waiting back to hear, then I'll definitely be there. If it doesn't get accepted, then I'll think about going. But if it's accepted, then of course I'm going. I'm going to be in M1 in Chicago in October. Nice. No, I didn't do med school in Chicago. I did in Alabama. Why are not people not believing I'm 31? Yeah, it's the skincare. It's the skincare and sleeping 8 to 9 hours of light. That's what makes the difference. Would you do full-time outpatient psych? I mean, I do outpatient psych now. So I'm in full private practice. I work all on my own. I know where that is. The building's right there in River North. Oh, nice. I took Dialects during pregnancy and noticed I could drink coffee again. I don't know what Dialectin is. What is Dialectin? Do you think where it matters where you go to med school? It depends. Depends on what you're trying to match into. So I knew I wanted to match into psychiatry. Let's assume we're talking American schools. So the hierarchy is USMD is at the top. Then like basically an MD from a US school. Then there's USDO is next to that. Then there's the Caribbean MD. And then there's schools from out of country, basically, like IMGs from all over. So that's the hierarchy, that's the ranking hierarchy in terms of how residency programs perceive you. So if you can go to a USMD school, that would be your best bet to get the best residency. I'm not saying it doesn't, heme on-cure doesn't matter, I'm a DO. Yeah, you can still match and stuff. DO's matched fine. But you are not going to lose anything by going the USMD route if you get the chance. You will limit your some opportunities it can make it harder to match in some things if you are not a USMD. For example, orthopedic, derm, plastic surgery, those super competitive specialties, optho, they prefer USMDs. If you're in something like psych, That's fine. HEMONC, yes, but HEMONC you got into after you did internal medicine. So the game for fellowship match is different than the game for residency match. For example, psych residency was hard as fuck to get into. Psych fellowship, I literally wore clothes like this, FaceTiming the program director, and they were like, you want to come? After the fellowship match happened. So that's the difference here. So basically, you just don't want to shoot yourself in the foot. Difference between MD and DO, I mean, they're the same clinically. Like, if you see a clinical MD, clinical DO, they've gone through the same training, so it's like literally doesn't mean anything. So, I'm a USMD, like, it literally doesn't mean anything. My friend, you get a DO psychiatrist, like, I don't even think twice. It means nothing. The only difference is that it's harder to get into a USMD school than I need a napkin, than a DO school. That's the only difference. But once you're in, it doesn't matter. The nap. Oh. Just initials at the end of the day. How many cups of coffee do you have? Like 1 or 0. I try not to drink coffee. It fucks up my sleep. But today was a travel day. So sometimes you gotta do what you gotta do. Wait, can you talk about these conferences? Yeah, people can generally go. Basically, they're just networking. The conference is networking. There's like lectures about the topic. So the conference that I'm going to tomorrow, APA, so a bunch of psychiatrists are going to be giving different talks. You can just search APA 2025. A bunch of psychiatrists are giving talks everywhere, like in the conference, and then people are flying from all over the country to network. What's the difference then? For neonatology, you have to do PEDS residency, the neonatology fellowship, right? Yeah, I assume so. Yeah. You have to do a PEDS residency, the neonatology fellowship, yes. I went to Ohio State. Nice. OSU, baby. I think you need to see an allergist. Yeah. I mean, it is what it is. I think it's just traveling. Zyprexa or Seroquel for acute mania. They both work well. Just have to make sure to use a high dose. When will the DSM-6 come out? I don't know. The DSM-5 came out in 2013, so I think they're not close enough to develop the DSM-6 just yet. It's not like mental illness has changed a lot, but the biggest problem we have right now is that the diagnostic system is not very... It's based on symptoms, so it's not based on underlying neurobiological differences. I still don't know the difference. Yeah, I should take my allergy meds too. Oh, they're right here actually. Generally curious if you're religious or not. So I'm agnostic. So what that means is that I believe that there is some higher power out there, but I don't ascribe to any religion, because religion is a construct that man makes to help believe that their lives have meaning, and to give them guidance and wisdom in the life, and to give them a belief system to follow, and to make death more of a pleasurable thing for them, so that way, they can believe in that there's something after, and it gives them hope. So I don't think it's a bad thing. I think that's just the functional purpose of it. And I think that just different societies developed different religions to help them with that need. How long should someone be on the same antidepressant? I mean, if it's working. But if it's not, then that's when you want to change. Are my chances of matching for a U.S. residency low if you go to a medical school in Frankfurt for psych? Yeah, they are low for sure. It's an uphill battle. Psych has become very competitive nowadays. And because people are realizing, mental health is more accepted than ever. Psychiatry is more cool now. Back in the day, like, literally no one cared, and it was like, it was a joke to match into psych. Average income for psych, like $250. I applied to DO schools only, did fellowship in OMM, holistic. I own practice, employ MDs in psych. Yeah, nice. Yeah, once you're in practice, it literally doesn't matter. Like, it's literally patients don't care. Providers, doctors don't care. Like, it's not something you think about. It's only something that really exists in the minds of, honestly, it's only something that only pre-meds think about. I'll be honest with you. I will stay here. I just got accepted to a school in Frankfurt. Nice, nice. How do they pick you to be a speaker? Well, if they sense your aura and it's good, then yeah, they'll pick you. Do you think because it is cognitive diagnostic? I don't know what that means. When we'll see PTSD be an American diagnosis? Yeah, we use more chronic PTSD. If you read the book, The Body Keeps the Score, it talks about some of the challenges that they had to try to get CPTSD approved, but it wasn't. So that was the main, but that's a thing for sure. Opinion on Vraylar. Vraylar is good. It's basically an antipsychotic that has less weight gain, so that's nice. It's just expensive. Is this a new map? Yeah. Yes, we have unlocked a new section of the map. I love it. I love it. Yes. Yeah. We fast traveled across the map. Your thoughts on Lexapro? It's a good starting antidepressant. It's a solid one just to start at. It tends to have low side effects compared to the others, and it tends to have low med interactions too, so that's a positive as well. Risk of not treating depression, injury to self would be the biggest risk, and also loss of functioning, like loss of functioning in your job or school or relationships, personal life, that kind of thing. Lexapro versus Celexa. So Lexapro is what we call basically Celexa has two enantiomers of the like citalopram. It's got like the R in the right and the left hand, and Lexapro is just the active form, which is just the right hand. So that's why the max dose for Lexapro is 20 milligrams, and the max dose for Celexa is 40 milligrams, because the Lexapro just has the active form of it. So it tends to have less QTC interval risk than Celexa does. So there's really no reason to use Celexa if Lexapro works. But sometimes if Lexapro does not work, but the patient wants something similar, then Celexa can work. Are you under the weather? Yeah. I think it was just the traveling. The traveling's been yeah, it was a long flight for sure. What are the cleanest SSRIs with the least side effects? That would be Lexapro. What are your thoughts on Zyprexa? It will cause a lot of weight gain, but it can help with sleep too. But it's a good antipsychotic. Like, it hits hard. Zyprexa is like a tank. Like, it definitely hits hard. Does Lexapro make you gain weight? It can. It's one of the lesser likely ones, but it can. Prozac is the least likely. I'm trying to find my nasal spray. Ah, here it is. Oh, wow, that actually just cleared up my sinuses. That's crazy. That explanation of Celexa and Lexapro alone was worth signing in on a Friday night. Thanks. Yes, I actually put this in the program as well too. So it's in my program where if we go to the Lexapro and Celexa lectures, like both of that concept is explained. Take Sudafed. Can you treat OCD without a depression medication? Yeah, you can use N-acetylcysteine. It's a supplement. You can use exposure therapy. Antipsychotics are used as adjuncts, but typically SSRIs high dose are the main treatment for OCD. My dad just died. I want some help to get through the night. Any sleeping pills? Well, I'm sorry about your dad dying. So you definitely need to process that grief, and the only way you process it is by going through the emotions of it. It's not by numbing or suppressing them. So sleeping pills, I mean, yeah, trazodone's fine. That was a good one. If there's a lot of anxiety, you could use hydroxyzine too. If there's a lot of like sympathetic stuff, like your fight or flight's really kicking in, then clonidine can be helpful too. But just make sure that you're not numbing yourself to where you're not processing the emotion. What's the best sleep med? I take quetiapine. Uh, what's the best sleep? Quetiapine's decent. It's good if there's like other mood stuff too. It just can cause weight gain, so that's just why I'm a little bit more hesitant on it. But it's good if that's yeah. If it's working well for you and like mood wise, it's good. Which psych drug will get me skinny? Vyvanse is good for binge eating. Stimulants, topiramate, metformin, GLP-1 agonists. What meds can I take in combination with methylphenidate for borderline and ADHD? Probably like a guanfacine or clonidine to calm. Magnesium citrate for sleep? No, take magnesium glycinate. Citrate is not the best. What does metformin do? Basically, it helps curb some of the binge eating, and it also helps with the metabolic response, so you're less likely to... We give it to people who are at risk of getting diabetes. Metformin. The audacity. Hey, you asked. How to treat bipolar with ADHD. You want to just treat bipolar first, and then you switch over to ADHD med treatment. I just started taking Lexapro. My heart is beating fast, and I feel nauseous. Is that normal? Usually in the beginning it is, but it can go away over time. I've been on temazepam. How is triazolam in comparison? I find temazepam is better than triazolam. But they're both not ideal long term. Glycinate, I'm tired. Yeah, glycinate's good. That's the one I take personally too. So bad for your kid. Thank you for your advice. Yeah, of course. Well, of course, right? Ideally, you don't want to take meds to help you lose weight. You want to lose weight by staying in a calorie deficit and eating healthy, and not and exercising regularly and sleeping regularly. I mean, that's the gold standard. Thank you so much. You are welcome. Hi, felt nauseous the first week on Lexapro, then went away. Thoughts on 700, 800 milligrams of caffeine? Oh, that's not good. That is not good. Bro, you need to cut that down. That's going to give you heart problems, heart palpitations, could even cause a manic episode. I remember I had this patient. She was like 20, 21 years old, so she was a EMS driver. And I was seeing her, and all of a sudden she didn't show up to her visit. So I was like, wait, like what's going on? And so I called her, she never answered. And fast forward a month later, she drops into the clinic, and I was like, okay, like what happened? So it turns out that she got off all her bipolar meds because of the weight gain that she was experiencing, and she was also taking a bunch of caffeine because she was a student, and she was also doing EMS jobs, so her sleep schedule was really messed up, and so she was driving the EMS vehicle. She was drinking like 600 milligrams of caffeine a day. She was driving, and her partner asked her to pull over. So she pulls over, and then the partner switches with her, and then ends up driving her to the hospital because he's like, you were driving at 120 on this road. And I was like, and so yeah, she was literally driving at 120, and so she got admitted to the hospital. She was having a manic episode, which was caused by getting off her mood stabilizers and using all that caffeine. Yes, exactly. She's got me. Yes, yeah. So the best way for me to see your stuff is to subscribe, and that way your comments will stand out above everyone else's too. Exercise is the best remedy for all challenges. I mean, I wouldn't say it's for all challenges, but it definitely is a good baseline to have. Effexor stuck in it for 15 years. Can I get off of it? Yeah, I have a patient I'm tapering off Effexor right now. For OCD, it hasn't fully helped her, so we're coming off of it right now. That's our goal for it.